What's up, ladies and gentlemen? Welcome back to Neuro Sketch. You look again. Welcome to Zima moto series. And what do we have today? This is what we have today, and that is ear. So the ear is divided into three main parts. You have the outer ear, the middle ear, and the inner ear. The outer ear is separated from the middle ear by the eardrum, which is also called the tympanic membrane. What sits in the outer ear? Exactly nothing. Nothing is sitting in the outer ear. And then in the middle ear, you have your famous ear oscus, your malleus, incus, and stapes, which is found in the middle ear. And in the inner ear is where you have your vestibule and the cochlea. So what the nerve supply to these structures, that's going to be the vestibulocochlear nerve. Yes, which is nerve number 8. Is it sensory or motor? Purely sensory. So what's the function of the ear? The ear is the important organ for hearing and the balance. So you are hearing by your cochlea and you are balancing by the vestibule. We have said what sits in the middle ear, the famous ear oscus, which are malleus, incus, and the stapes. Now, in the middle ear, we have the muscles which are attaching to the tympanic membrane. These muscles are called the tympanic muscle. So we have the tensor tympani. The function of this muscle is to tense the tympanic membrane, which is called the eardrum. So this muscle is tensing the eardrum. And then we have the stapedius muscle. The stapedius is attaching to the stapes. The function of stapedius is to dampen the sound. Okay, to dampen the sound. Now, the tensor tympani is a derivative of the first pharyngeal arch, and so it's supplied by mandibular branch of trigeminal nerve, which is V3, and the stapedius muscle. It is the branch. It is derivative of the second pharyngeal arch, and so it's being supplied by the facial nerve. Okay. So if someone gets injury to the nerve that supplies the stapedius muscle, they are presenting the condition is called the hyperacusis. They interpret even low frequency, low amount of sound as huge noise in their noise, because they have injured this muscle, because this muscle was doing was dampening the sound, was reducing that component. Yeah. So that's it.